Hi guys, welcome back to the How Podcast. This is a hospital outbreak weekly where hospital outbreaks are explained weekly to the general public who may have limited knowledge of medical background. There are three different segments of our podcast: the opening, the question segment, and the closing segment. Stay tuned for this week where we dig deeper into the GNMH hospital, also known as the Garcia Newgard Memorial Hospital, where an outbreak has occurred. How has these 11 patients gotten sick? We welcome in our the hospital director, Margaret, our interviewer, meet Miranda, and then let's figure out what happens at this hospital. Let's say hello to our hospital guest, Margaret. Please say your name and occupation.
My name is Margaret Jalakis, and I'm the hospital director at the GNMH hospital. Basically, I oversee everything that's happening at the hospital and make sure everything is running smoothly.
Okay, let's get into some questions. Hello, Miranda.
How did the outbreak start?
It was so unfortunate. All of a sudden, we discovered that 11 patients had contracted a mysterious disease, all with similar symptoms. We didn't know what was causing it, so we decided to invite the PLTW defense team to help figure out the source.
Oh, that's quite interesting. Was everyone freaking out since no one knew what was causing the outbreak?
Yes, people were quite nervous. We knew we needed to act quickly or the patients could get worse.
What were the first steps to trying to control the disease, if any?
There were a lot of first steps. These measures included frequently washing our hands, wearing masks, gloves, and gowns, disinfecting all medical equipment and other hospital equipment, quarantining infected patients, and maintaining good airflow and removing any waste or bodily fluids. We also educated the staff, patients, and visitors about sticking to the rules and guidelines to prevent outbreaks.
Were there any parents with the patients, anything in those first moments of trying to figure out the disease where there was something to go off on? If there were any hypotheses you could use to discover the source, maybe the patient's symptoms or location in the hospital?
We mostly came to our conclusion through the 11 patients and the conditions because the symptoms were similar. All the patients were also put on IV saline, but we later discovered that this was not the source of the infection. A lot of the patients were developing different types of infections, some with infected wounds and cough and difficulty breathing. Many of them developed conditions like pneumonia or bronchitis and are all around the 4 to 6 day mark. We also noticed that the activity where the most infected patients were is the ORB, ORA, and the recovery rooms on both floors, also the ICU and the step down. One of the hypotheses that we eventually landed on is that the infection originated from the antiseptic wipes because a lot numbers match with the locations where the infected patients were located.
When did you first find out about the outbreak? Did you think the doctors needed to alert other patients or the public about the mysterious infection? Why or why not? What information could they share at this time?
Well, we had to be careful about this because we couldn't share everything and risk the public getting worried or nervous. We had to be strategic and only announce what we know so far.
Hi guys, if you were here for the other How Podcast, you might not know what this next question means. The next question talks about the agents of disease. What are the agents of disease, you might ask? What's the type of virus or disease that causes a disease? The different types of agents are prion, bacteria, harmless viruses, protists, and fungi. Since we did a bit of further research, the damage prions cause to the host is brain damage, since the prions can cause the proteins to not become not so normal, causing clumps in the brain. Bacteria can cause tissue damage and create toxins that are harmful for the body. The damage it causes to the host is it can strip out essential nutrients to the body and needs for food and eat, so it causes organ and tissue damage. The damage to host cells for viruses is that the tissues are demolished, causing multiple different kinds of things. Since protists are in the digestive tract, organs, or blood, they can typically get the essential organ nutrients found in food that the body needs. This can cause tissue and organ damage. Fungi causes tissue damage. Well, that's it for the recap. Please keep on enjoying the podcast.
You were interviewing the agents' diseases in the hospital. The moment were you able to narrow down the possible agents? What caused the outbreak? How do you get your final diagnosis of staph infection?
We were able to narrow down the agents by looking at the symptoms of the patients. We were eventually in between viruses and bacteria because all the other agents would not cause symptoms that were consistent with these at the patients. This is because the symptoms were severe cough or a respiratory infection and irritated skin and an infection in the skin. Furthermore, we were able to match these symptoms up with staph infection, and we later tested this in a DNA test and found it to be a match.
Hi guys, before we go to the next question of the podcast, let's do a little review on a chain of infection. What is a chain of infection, you ask? A chain of infection, in simple words, is how the pathogen or the infectious agent spreads from one person to a thing or another. This includes the infectious agent, the reservoir, the portal of exit, the mode of transmission, the portal of entry, and the susceptible host.
What was the chain of infection of the disease spreading in your hospital? When you were researching the possible chain of infection, what possibilities were there for the reservoir in the hospital, portal of exit from the reservoir, mode of transition, portal of entry into a host?
For the reservoirs, a lot of patients were walking around the hospital making the possibility for a spread of infection. It's possible that the reservoirs could be environmental since there are a lot of sinks and drains and other types of surfaces. Hypothesis would be that the reservoir would come outbreak from the surfaces and not sterilized equipment properly. We finally landed on antiseptic wipes though, as being the portal of entry.
Are there any treatment for this disease?
Well, since the staph infection is a bacterial infection, it can be treated with antibiotics. But in severe cases, surgery might be needed to cut off infections parts that may have spread to other parts of the body. Also, wound drainage would be an option.
Hi guys, I know you don't want it to end, but it's time for our closing segment. Our closing segment always starts with a conclusion of what we went over, and then the finishing question: what can the general public learn from this outbreak? So after close examination and inspection of the PTLW defense team has come to a conclusion about the source of the outbreak and how to treat it. They've determined that the agent of the disease is bacteria, and the specific species is Staphylococcus aureus, or a staph infection. The source originated from the contaminated antiseptic wipes that were distributed to the rooms where the 11 patients had contracted it. We must immediately cancel the next shipment, and change the distributor to prevent others from contracting a staph infection. As for the patients who already contracted the disease, you might ask, they've already started on antibiotics and being monitored. If their situation might worsen, we might need to give them a new form of antibiotic or even go surgically remove the infected portions. We should continue quarantining the infection patients and We can begin spreading information about the outbreak on the news to inform the public and patients. Lastly, all safety precautions must be taken, including washing hands, wearing masks, gloves, gowns, etc. Sanitization, disinfecting of all medical equipment and other, maintaining good airflow, and properly removing any waste or bodily fluids.
What are the strategies for prevention and surveillance or ongoing monitoring?
First, the preventive strategies include proper sanitation and hygiene. In particular, frequently hand washing, surface disinfection, and maintaining sterilization in the medical equipment. We should also quarantine the patients and educate and train the hospital staff and employees about the importance of following the guidelines to prevent infections. Tracking symptoms of patients and looking for patterns will also be necessary to identify trends and maybe identify the point of entry for the disease.
Now, you might ask what the public can learn from this. There are so many things that you can learn. You need to learn how to wash your hands and keep your proper sanitization. If you're around something nasty, or you are bound to get sick, use gloves or goggles to protect yourself if you need to. Another reason why this podcast is so helpful is that people can understand problems in hospital, especially diseases. The public can learn how diseases spread in the chain of infection, so people know how to prevent the spread of disease. Another thing public can learn is how different types of healthcare work through disease. You can see that through this hospital, they work through big disease and outbreak. The biggest thing that the general public can learn is how to protect yourself. Keeping yourself disease-free is the most important thing. Thank you guys for staying tuned for this week's How Podcast Hospital Weekly, and get ready for next week's podcast. It's a big one.